Hello, welcome. I'm Sarah from Heart of England Ayurveda. Today I'd like to share with you a short practice for back care. If you tend towards chronic back pain, it's a really nice little maintenance practice. However, a few things to be aware of. One is that if your back pain is acute, so if you've recently injured your back, then this is not the practice for correction. It's best to see someone, get an assessment, get treatment, wait till you're over the acute stage, and then maybe come back to this practice. Also, if you're in a flare-up of pain, so we say on a scale of 1 to 10, if your pain levels are above 5, then again, rest, care to get the inflammation down is the best strategy before coming to movement and practice. Okay, so for the practice, you might like to have at some point a bolster, cushion, or pillow that you can place under the back of your knees if it's uncomfortable for you to lie back with the legs long. Now I'll put that aside and let's begin. So I will practice with you. Please lie back with the knees bent and the feet flat. And have the outer edge of your feet aligned with the outer edge of your knees and your feet underneath your knees. And just take a moment to become aware of your body, your breath. Feel the feet settling into the floor, the back of your hips, your rib cage, your hands, your arms, shoulders, head. Please be aware of your body breathing. And then begin to establish yourself in a regular breath pattern. So maybe you inhale for 3 or 4 counts and exhale for 3 or 4 counts. Okay, that's great. And then we'll continue to move with that regular breath pattern as we go through the class. And for now, can you just take your feet a little in front of the knees and wider than the hips? So maybe the outer edge of the feet align with the outer edge of your hips. And the first practice is to bring a little stability around the balance, around the sacro iliac joint. And a key point to remember also is we don't move. It's not a practice here where we push through pain. That's never a good idea. We want to move just before the point of pain, okay? So maybe you don't go all the way into a movement or all the way into your capacity if pain's arising. And on the exhale, we're going to lower the right knee towards the left ankle, keeping the left knee vertical. If you get like a good stretch sensation across the back of the hip, of course that's fine. But if it's an ouch, if you get like a nerve twinge, that's a red light. And so just back off, come a little bit out of the movement. And then we'll inhale, we'll bring the knee up. Left knee to right ankle, exhaling. Inhale the knee to vertical. Exhale, right knee down for your 3 or 4 count breath. Inhale up. Left knee. Inhale up. Right. Inhale. Left. Inhale. Right again. Inhale, left, inhale, last one to each side. Good. When you're finished, please come back to center with both knees, feet back to hip distance apart. Take a few adjustment breaths, staying with that even breath pattern. And then on your next exhale, can you lift your tailbone and tone your belly back towards your spine? The back stays on the floor, just your sacrum lifts, so you come kind of onto the top shelf of your sacrum. And as you inhale, relax the tailbone back down and feel maybe that natural lumbar curvature, the curvature in your lower back re-establishing itself. Exhale, we lift the tailbone, the lower back flattens out, we find the top shelf of the pelvis. Inhale, we relax the tailbone back down. A few more like this. Smooth movement through your even breaths. And after your next inhale, just relax the practice. We'll take a few breaths again in stillness. Fantastic. And then checking your feet are hip distance apart, palms down alongside you. We're going to press down through the feet. And this time on an inhale, we'll lift the pelvis. And we're going to lift the back as if we're peeling the back away from the floor, vertebra by vertebra. And we finish the movement at the top of your inhale. Keep the base of the big toes grounding down. As you exhale, you're coming down again with control, vertebra by vertebra, reaching your tailbone towards your heels. The movement finishes at the end of your exhale. Let's do 4 more like this. Inhaling, vertebra by vertebra. Onto the top of your shoulders, finishing the movement at the top of your breath. Exhaling down, placing intentionally each vertebra back down. 3 more. Keep the 4 corners of your feet grounding down. Support stability. 2, inhale. Exhale. Last one, inhale. And exhale. Good, and relax the hips, the pelvis, the back, shoulders, your face. Feel your even breath. Good. And for the next step, we're going to bring the knees into the chest. And if you know you're not so strong in the core, in the hip flexors. You definitely don't want to feel this next practice in the low back. You want to feel it in the muscles on your front body, top of the thighs, maybe in your belly also, but particularly the muscles at the very top of your thighs. So please sit on the back of your hands if that helps you. Those of you a little stronger, you can keep the palms down alongside you. And we'll inhale the legs straight up. I know for some of you it's going to be difficult to align the ankles over the hips with the knees long. So please feel welcome to bend the knees until you can take your thighs to vertical. So the hips stay directly over the knees. And you still move with us in the same way, you'll get the same effect. So we're lifting into the heels. We've got the legs vertical. And on an inhale, take the legs just a slight different distance away from you. If you go too far, you miss the work for the top of the thighs. And as you exhale, bring them back. Inhale, take them away from you. Exhale, bring them back. So often where there's low back weakness, there's a weakness in the hip flexor muscles. So by strengthening these muscles, we're giving support to the low back. So you're inhaling the legs away, exhaling towards you. And my bet is that already a lot of you will be feeling it in the top front of the thighs. Not feeling it, try reducing the movement. You could be going too far towards the floor. Let's do 4 more. Good. Next exhale, please bring the knees into your chest. Hug them in. Take a few adjustment breaths. Good. And then please place the feet to the floor. Again, hip distance apart. We'll take the arms out to the side, perpendicular to the body. You could bring the feet together. Some of you might even like to actually bring a brick between the knees and you can engage the muscles of the inner thighs in towards the brick. Again, to add a little extra stability to the practice. We're going to exhale the knees over to the left as you turn your gaze to the right. Remember, you're not going into the point of pain, you're moving just before the point of pain. Inhale to center. And of course, we all have asymmetry, so it might be different on each side. Exhale to the right, turn your gaze away from the knees if that's comfortable for your neck. Otherwise, keep your chin centered. Inhale. Just continue like this, smooth movements through your even breath pattern. One more to each side. Good. And please take the feet hip distance apart. Bring the arms into the Shavasana position. That's hands, palms turned out, hands just a little wider than shoulder width apart. Reestablish yourself in your even breath. Feel your exhale releasing any lingering sensation in your low back after any of the practices. Very nice. From here, please roll onto your right side. Bring your left hand into the floor and let's come up onto the all fours position. Just a couple more practices here for us this morning. So whilst we're maybe taught in class to have the hands underneath the shoulders, for us in this yoga therapy approach, we bring the hands as women. That's the alignment for men is underneath the shoulders. We say for women, because we have what we call a carrying angle through the arms, we actually bring the hands a little wider of the shoulders and a little in front of them. We also want to make sure we're not flattening out the lower back. What I see in class is those with lower back issues often they've lost that lumbar curvature in this posture. So always make sure that you start by just dropping the low back a little. So we start with the spine and its natural integrity. Curvature in the low back, curvature in the neck as we look straight down. And then on an exhale, we're going to tuck the tailbone and lift each vertebra one at a time, feeling the breath traveling up the spine to the base of the skull. And then as you inhale, again, the breath travels from the tailbone up like a wave. So again, you're moving vertebra by vertebra, finishing the movement at the top of the inhale as you lift the chin, lift the gaze. And exhale, tailbone tucks under, and then lift vertebra by vertebra, lowering the chin, the head at the last minute. Same for the inhale. You start at the tailbone, moving vertebra by vertebra. We lift the chin at the last moment, at the top of the breath. Let's do 3 more. Mindful, slow movement, following the wave-like movement of your breath up your spine, each part of your breath. The last one. Good. And then relax into a neutral position. Relax the hands, sitting back for a moment if that helps you. And then we'll meet back on hands and knees. Again, in neutral in the spine, so lumbar curvature, cervical curvature in the neck. And today now on an inhale, we're going to extend the right leg back. Don't hike the right hip up. Lower the outer edge of the hip towards the floor, so both hips are an equal distance from the floor. Lift the inner knee, and then lift the heel a little higher than hip height, and turn your toes out to the right, and take your leg just a little, maybe 12 inches, 30 centimeters, out to the right. And you'll feel the muscles at the back of the hip here engage. You'll know when you're in the right position. This is building stability around your sacroiliac joint, key for many back issues. Hold here a few breaths. And then bring the leg down. Same to the left side, extend the leg up. Lift the leg to hip height, squaring the hips on so the left hip doesn't hike up. Turn the left foot out so the inner edge of the foot is parallel to the floor. Take the leg off to the side, about 30 centimeters, 12 inches. The foot is above hip height, about a 30-degree angle. You'll feel the muscles at the back of the hip, kind of gripping, toning. Breathe here. So once we feel the sensation go into the joint, into the low back, and out of the muscles, we know it's enough for us today. That's the time to come down. Let's do 1 more to each side. Lift the heel higher than hip height, square the hips on, turn the foot out to the side a little. Let's bring the foot down, knee down. One more, left foot, lift above hip height, turn the toes out to the side, take the leg off to the side. Very nice, and bring the leg down. Let's do one more cat-cow. Inhale, lengthening forward, and exhale, vertebra by vertebra, tucking the tailbone, lifting the back, head lowers last, and then slowly, smoothly inhale to neutral. Very nice. And come to sit up and come to rest on your back. So you might like to take a bolster under the back of the knees. We're going to take the hands into this downward pointing triangle shape. So 4 fingertips together, thumb tips together. Rest the palms on your low belly. And we just rest here and bring our awareness, bring our breath into the space between the hands. Allowing the practices to integrate, allowing the muscles to relax, the mind to become calm, nervous system calm, and all the energy, the prana, to come home to balance in the pelvic area. All this will happen as you rest your awareness in the rise and fall of your breath in this space between your hands. And please stay like this, ideally for 5 minutes, at least for a couple of minutes. And try this practice at least 4 times a week and see how it works for you, for your back. Okay, thank you for joining me. Hope you enjoyed the practice. Thank you.